Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey vet rehabbers, today's episode is a revisit of one of our Facebook Lives with Anae and Jaclyn Coble. Jaclyn shares her journey from veterinarian to rehabilitation therapist with a beautiful focus on pain management and palliative care. So what I love about this conversation is how it evolved. She was part of the Onlinepethealth community. She became inspired to pursue her rehab certification and then take it even further, creating her own app called Rosie Paws. It's such a wonderful example of what's possible when you follow your passion and start thinking a little differently about how you can support your patients and their owners. In this episode, they dive into palliative care and pain management, also explore how tools like Rosie Paws can help owners really stay on top of their pets' day-to-day care, from pain levels and medication to diet and overall well-being. This conversation is more than just clinical, it's actually inspiring because it shows how one idea or one step can open up completely new ways of helping animals while also creating an additional income stream that aligns with what you love. If you like to keep learning, we've just updated the free webinar area with some fantastic webinars you can access right now. In the small animal section, Talking Tendons, Advances in the Management of Tendon Injuries with Diane Messam. In the hydro section, Using Hydrotherapy to Manage Developmental Conditions in the Dog with Tanya Grantham. And the equine section, Luxating Patella in the Young Horse with Gideon Sabal. You can head over to onlinepethealth.com/free. Before we head over to that revisit of that Facebook Live, a quick word from our sponsors. Founded by Dr. Beate Egner, the Veterinary Academy of Higher Learning, also known as VAL, is shaping the future of veterinary rehabilitation worldwide. VAL stands for Evidence-Based Education, Global Collaboration, and Real Clinical Impact. Our mission is simple but powerful, turning science into practical skills. With programs offered worldwide and in multiple languages, VAL helps clinicians combine scientific insight with hands-on expertise, so patients move better, recover faster, and live healthier lives. Flagship certifications include the Certified Canine Rehabilitation Practitioner, also known as the CCRP, the Certified Equine Rehabilitation Practitioner, also known as the CERP, and the Certified Canine Fitness Trainer, CCFT programs. These are all developed by the University of Tennessee, Knoxville, which is not only considered the birthplace of evidence-based animal rehabilitation, but it's also the host of this year's iAVOPT Symposium. To explore VAL globally, you can visit val.vet and follow VAL on Instagram at val.vet. Right, over to the chat with Anae and Jaclyn.
Hi guys, and welcome. Hi Jaclyn, thank you so much for joining me.
Hi, thanks for having me.
So we have Jaclyn Coble with us today. She has lectured for us at Online Pet Health previously. She spoke about the role of rehab in the palliative care of skeletal cancer patients. And I loved that webinar, and I knew that I needed to have a further conversation with you on this topic. So Jaclyn, thank you so much for joining me today to talk about living well with pain, redefining success in chronic and palliative care. Okay, so Jaclyn, can you introduce yourself, your journey, and your interest in today's topic?
My name is Jaclyn Coble. I am a veterinarian based out of the U.S. in Boston. I graduated in 2012 and was an emergency doctor for several years until I was looking for kind of a career shift. And at the time, I discovered online pet health and rehab, and then had to go to acupuncture for my own injury. So that kind of all piqued my interest, and I got certified in rehab from the University of Tennessee, and then did my acupuncture training at Chi University in Florida. I will hopefully be taking the certified veterinary pain practitioner exam this year. Just haven't gotten around to it, but I opened my practice, Sea Legs Integrative Veterinary Health in Boston, Massachusetts, in March of 2023. So coming up on our 3-year anniversary. And
Wow.
we've been getting busier each month. And we've added an associate doctor now, in addition to some technicians. Um, and it's just been awesome. And then I've been a huge fan of online pet health for years, and I we had there's always the talk about, making money online and digital products. So I also did put myself out last year and make a pet quality of life monitoring app called Rosie Paws. So if you guys want to check that out, it's at rosiepawsapp.com. And it's a web-based application where you can monitor your animal's pain scores, activity, hydration, feeding, and blood sugar and seizure logs. So that's been kind of a side project for the last year, but just the last 6 months it's been active. So I've been doing things to also bring publicity to that, and I'm happy to share some of that with you if we have time today.
Wow, so online pet health has been kind of a part of your journey since before you walked into rehabilitation, and
Mhm.
we were part of the inspiration that made you take the step to create an online or Paws app. I think
Yeah.
that's so amazing. Thank you for saying that because we always share the information and are encouraging. It's really nice to hear um, that someone's doing it and
Oh, yeah,
that we
definitely.
can
Megan's
help you share
emails.
that cause right now. That's so cool.
Yeah. Yeah, Megan's emails and like pushing all of us to try digital products and to try, alternative income streams in case, someone gets hurt or in case something shifts. And it's been really inspiring and I'm really proud of it, even though right now it hasn't really taken off and become successful yet, but it's still a baby. So,
Yeah. When did you launch Rosie Paws? That's very recent, right?
yes, that was September.
In September. Okay. We are, yeah, guys, if you follow Online Pet Health and you're live with us here today, you already know this, but we really are all about community and we are honestly you guys' biggest fans. So
Oh, thank you. That's sweet. I'm your biggest
when
fans, all of you, all the lecturers and everybody organizing everything. So thank you.
thank you. So if you guys are doing amazing things online, let us know because we really want to be there in your corner, cheering you on and encouraging you. But okay, let's get back to
Mhm.
today's topic, which is chronic pain and
Mhm.
redefining success, right? Which is very much part of what Rosie Paws helps us do. So
Mhm.
let's talk about chronic pain. It's often subtle, where dogs are compensating and they're finding ways
Mhm.
around that. So, what are some of the signs or patterns you see that tend to be missed or misunderstood? And that could be both by owners or professionals.
With owners in particular, I think it's just taking the age of your dog into account. Like, oh, well, he's 8 now, he's slowing down. When you're talking about their activity level and their ability to exercise, and especially with that example where I'm like, well, they're only 8 years old. Like that's not that actually that old in the grand scheme of pets. But I feel like that's the cutoff since I think that's when we start calling them senior dogs. That
Mm,
everybody kind of, veterinarians included, are kind of like, oh yeah, I mean they're 8 now, they're old, so they're going to be kind of slower, but miss the actual subtleties that 8 years old a dog can be in excellent shape still. But you also might start to notice, yeah, some muscle wasting from compensation
mhm,
or kind of old injuries coming back to roost. Because if you think about like I picture like an 8-year-old dog as like a person in their like 60s, and
mm,
a person in their 60s probably has some degree of chronic pain from various injuries throughout their life. And it's kind of the age where they all sort of come home to roost. And that's when you have to be really proactive with diagnostics and just general exercise to just keep those pets in motion, because the more that you accept that they're slowing down and they're just going to sleep all day, the more they're just going to sleep all day.
Yeah. Yeah.
Mhm.
I like that. I'm looking at my own dog recently, and she's about 10. She's a little tiny 3 kg
Mhm.
dog, and she's starting to waste away a little bit. I can see the change
Yeah.
in muscle mass. So there are no real changes in her behavior or activity, but I can start to see changes in how she's muscled. And so that's one of the signs for me that I'm like, hey, let's start paying closer attention to what's going on here. Okay. So how do you distinguish between a pet slowing down as a result of age and then one that's actually experiencing pain that can and really should be addressed?
So it can be tricky depending on the pet, especially with like how stoic they can be. What I usually do for all of my appointments is I'll have all of the vet records from anyone that's ever treated them, and I try to go back to at least 4 years, and
Mm,
then double check in the record for any, like, have they had a TPLO previously? Do they have evidence of hip dysplasia as a puppy? And just look for any of those problems that may have developed a long time ago, but are just starting now to kind of decrease their mobility. And
mm,
then when I'm talking to the owners, I, take pretty detailed, like, what is their exercise level? How are they doing it this year versus last year? And like, do you feel, what is their enthusiasm for walks and their enthusiasm for exercise as opposed to last year? And then I
mm,
also always make sure I ask every owner, like, if I do something that hurts, are they going to tell me? Because
mm.
you've got some pets where, their reaction to, touching their lower back is just turning around and looking at you kind of, and maybe like licking their lips, but nothing really obvious versus, you've got a beagle who will let you know if anything hurts.
So I love that you mentioned the old injuries kind of coming back.
Mhm.
They may not have been ever really important or relevant to the dog in affecting their life, their mobility, and all of a sudden they're affecting them in more ways. That's exactly what I'm seeing with my girl because she has mild patella luxation, so not
Oh,
something that's
yeah.
ever bothered her.
Mhm.
But now I'm seeing the muscle wastage. So I like that, the history of old injuries and how that's affecting them. Um, okay, so when we talk about palliative care, what does that actually mean within the veterinary context, and how is it different from end of life or hospice care?
Mhm. Um, they're used pretty interchangeably
Mm,
here kind of in the States with people medicine, but with pets, I distinguish it between, palliative care is the main word palliative, comfort care. It's keeping your pet comfortable and happy despite any underlying injuries or life-limiting illnesses that they may have developed. Versus hospice care, we tend to think a little bit more like, oh, you know, they have, stage 4 cancer. Chemo is not going to help this person anymore. So we're just going to, keep them comfortable throughout their remaining days. Whereas for
mm,
palliative care, I try to have people focus on the actual quality of life and not the quantity, and that
okay.
we're going to, be treating them with medication and rehabilitation and acupuncture and things meant to allow them to live their life like they weren't sick or they weren't injured, as close as we can come to that initial baseline for as long as possible.
So quality over quantity.
Mhm.
Um, so this also is going to include like end of life conversations,
Mhm.
right? That's a part of that process and that management is finding
Mhm.
where is quality going to decline, and if we're prioritizing quality over quantity, um, could that time be earlier than you might have otherwise thought? Am I on the right track there?
Yeah, definitely. And a lot of that is just really detailed conversations with the owner about what they want for their pet, um,
Mm.
what their ability is to care for their pet, because sometimes I'll see, a big 80-pound lab with some kind of severe end stage mobility issues. And if the owner lives on a 3-floor walk up here in the city, it's not really sustainable for them to be able to get them in and out.
I'd love to talk about that what does living well with pain look like? And then, especially if we're thinking about a degenerative condition, something that's going to continue to go downhill, how are we going to manage that? I often think that we have this perception around pain that we don't want any pain. We don't want to live with pain. And that's not always possible. It's not always realistic. So while I think it is a good goal for us to have most of the time, we can't always get away with that. So in those cases where pain is a part of the equation and we're not going to get away with it, what does that look like? And how do we make sure that quality of life isn't compromised as a result?
Yeah, that can be very delicate with owners and people and their pets, just because a lot of people have different ideas of what quality of life looks like. I have some, owners who are not necessarily against euthanasia, but the thought of euthanasia due to something like orthopedic disease, where one would think that, oh, that's treatable. Like, I have arthritis and no one's going to put me to sleep. So it's having some detailed conversations with the owners about kind of their expectations and like belief system around just life and death in general. And then also creating realistic goals for both the pets and the owners. So if you have a very active owner who's used to, running with their dog or taking their dog for a 3-mile hike every day, we have to say, he's probably not ever going to really make it through that hike again. But if we are, strengthening his back legs, if we maybe are using like booties or another mobility aid, they can still go enjoy themselves on kind of shorter walks closer to the car, things that you can cut short if you need to. Don't find yourself stuck out in the middle of the trail with your large dog that you cannot carry that is suddenly now too weak or uncomfortable to walk. So that's how I usually approach the conversations, is usually by one of the first questions in my questionnaire is, what are your goals with this visit, to make sure that everybody's goals align and that we're not being too cynical or too kind of rosy-eyed, hoping that, everything's just going to get better and they're going to be fine.
Yeah. That makes me think, quite often we have very different ideas of what quality of life looks like. And there are times where that can be very much in conflict with an owner's beliefs or their preferences, right? So if I think about myself personally, I would always put to sleep sooner rather than later if something's degenerative and it's going to be painful and it's going to really badly affect their quality of life. I might do it on one of the soonest, bad days, or one of the earliest bad days, because I know where it's progressing to. But there are a lot of people who need to have very, very many bad days before they're ready to make that decision, or their idea of what a bad day is could look really different. And so there, as a professional, there shouldn't be any judgment from me. I should be able to help them navigate that path, and walk alongside them regardless of when they choose to make that decision, right? It's theirs, it's not mine. But my personal beliefs, especially when I believe that an animal is suffering, could make that difficult for me. And I know that I've had conversations with other professionals who have felt the same. who have felt that you can't, especially when paralysis is involved, for example. There are entire countries where mobility devices are not an option. And so euthanasia is one of the first things that happen when a dog loses mobility. Whereas for other countries, dogs can live without hind leg function for many years and have a good quality of life because they're not actually in pain. So how do you navigate that difference in foundational belief or understanding if you feel that you have a very different idea of the level of suffering that this animal or this dog is going through? You don't agree with the owner's decision. How do you navigate that space?
The nature of my practice, since it's pain management and rehab focused, I tend to select for people that do want to do everything for their pet and are willing to more tolerate like the bad days if they think that they're going to get some more good days coming. So there's only been, I can only really think of 2 off of the top of my head where I had to tell people I really can't help your pet anymore, and I truly believe that they're suffering, and that I don't think this is the life that you would want them to have or that they would want to have. And one of them was a dog with really severe degenerative myelopathy, and was pretty advanced, where the dog had minimal motor in its hind legs and no bladder control. And the owner, in like her goals, she was like wanted to do hydrotherapy because she was under the impression that if she did hydrotherapy that like her dog was going to be cured and her dog was going to be better. And I had to explain, unfortunately, like hydrotherapy has been shown to improve the quality of life and improve their mobility. And it's one of the, rehab is one of the few things that have been shown that definitely helps these dogs. But nothing I do is going to have your dog's leg motor function return. Like, even if I was the best veterinarian in the world, like, we just cannot do that. And this person did have unrealistic goals and did get frustrated with me and just felt that I was being very negative and focusing on the negatives. And, I tried to relate to them as best that I could, but ultimately, unfortunately, it was decided that we weren't going to work together. It wasn't going to work out. And those are really hard, difficult conversations, because a lot of times, like with other ones that kind of teeter on that slope, I want them to keep coming because I feel like I'm their best chance to keep the dogs as comfortable as possible, even if the owners aren't going to follow kind of what my direct recommendations are. I still want to, okay, well then I'm at least going to be seeing them and doing acupuncture, their medication, checking their feet for sores, and making sure that everything's treated and they're as comfortable as possible. And that's what for the other cases where I think that they're going on too long, that's what I tell myself is like, they have their belief system. They know their pet better than I do. They want to keep going. They aren't ready to make this decision for their pet. So then my role switches from, trying to convince them to just, okay, you've made up your mind. Let's do what we can to give your pet the best life possible.
Okay, I think that's so valuable to think about, and to I love that you haven't had very many cases like that. I think that speaks to the fact that you're very clear in the kinds of people that you're attracting to your practice. I think that's awesome and that's good. But you said there was at least one, and I think there's always at least one. And I feel that we need to be comfortable, like you said, to be able to make that decision ultimately that this relationship isn't going to work and it isn't helping any of us. And I think that helps us safeguard our own mental health as professionals if we can be okay to stand in the place where we say, I actually cannot help you. And it isn't a fault of mine and it isn't a fault of yours. We just can't work together. Yeah, that's tough. Tough. So for the owners that are aligning with you and that do work well with you, how do you help them navigate that emotional roller coaster of the good and the bad days, especially when those bad days are starting to get more and more?
Well, this is a good opportunity for me to kind of show like what Rosie Paws is, and kind of something that I've been basically just giving my clients this platform for free just to get feedback on it and find out if they find the tool useful, what I can fix to make it better. But if I go and share my screen.
Yes, please do.
So
Okay.
this is kind of, yeah, so this is the homepage for Rosie Paws. I'm going to sign in as a guardian, not as like the administrator. So now, oh, good morning, Jaclyn. So here I have my dog here, Chip. He's 14 years and 3 months and about 32 pounds. And then in his dashboard, I'm able to log in any medications that he takes, which I can then set reminders where it'll email or text me like time to give Chips Keppra. And then I can kind of look over his pain trends for the last weeks to months to days, however long you're taking it. So he was a little exhausted recently after playing with his cousin. So he definitely was sore and stiff this morning as he was getting up. So I logged that as a 1 because he still went down the stairs. He still went out for a walk enthusiastically, but I could tell just by kind of the stiffness in his back legs that he was having some difficulty. Then if I see that, I'm able to come over here and log that pain score. So I'll select Chip here. We have all of the different pain levels kind of over here for you to reference. And but yeah, so mild pain, slightly uncomfortable, and those are on the canine brief pain inventory scale is what we used for that. But I can say he had mild pain symptoms. Hips were stiff this morning. Then pain location, hips. Pain triggers, playing with Elka, which is his cousin. Pain relief, we gave him a carprofen this morning and gabapentin, and that was 2 hours ago. And then now I'm able to log that along with how well he ate, especially if you have a dog that's dealing with nausea or inappetence due to some kind of illness, or if they have IBD or cancer, or if they're going through chemo. You can log, what they ate, how much they ate. We have kind of the main brands up here, but then you can put notes in the bottom, like of exactly what type of food it is. But we'll say it's Sills, and then how excited were they? I like these faces. Yeah. So he was hungry, but like wasn't ravenous. Or other days where he ate all his food in 2 seconds, he was ravenous. And then we can say just now, and then we'll say we gave him, Hills KD, and I put a little chicken topper on it, just so I can remember the things that I use to coax him to eat. For other patients, if you kind of join at a higher level, you're also able to enter in their blood sugar and kind of keep a log that way and be able to visualize that trend over time. And seizures, where you even have the option to upload a video of the seizure just so you have it all in one place, so you're not scrolling through your phone to show the vet when you go. You're able to say, let this didn't happen, but yes, Chip had a seizure and it was moderate and it lasted about 2 minutes. We don't know what triggered it, and then it took 30 minutes to get back to normal. I could upload a video here if I wanted to, if I was on my phone, and that was recorded 3 hours ago. So now if we go back to our dashboard and we go through all of the different trends that we've been tracking, we can now go down seizure tracking. I haven't, I logged a seizure for the first time today in January 20th. He hasn't had one in over 2 months. We notice that, they're having them 3-4 times a month, then we can revisit their medication schedule and their anticonvulsant therapy and see if there's something else we can do to improve the quality of life for that pet. And then it just gives us overall just a way for owners to sit back and kind of just look at something without, asking AI or without, like, how do I know when it's time, or how do I know if my dog's blood sugar is in the correct range? How do I know if the insulin is effective? How do I know if my seizure medications are working? It's really just available for you to look at that and then to show your veterinarian, and just so that everyone can make decisions together about what the owners feel the pet's quality of life is, what the veterinarian feels, and then kind of find that healthy medium where we're doing everything we can to help the pet and keep everybody as happy as possible.
Awesome. So I feel like from an owner's perspective, the journey of watching your pet age or watching them degenerate with a condition can be so I just want, like, that disempowerment comes to mind all the time, because you don't know what to do, you don't know where to start, you don't have information. You might go to the vet and feel like they're only giving you a tiny little bit of information. They only give you like the smallest little crumb to work with. And this gives you so much, because it puts all the power in your hand as an owner. It lets you track what is happening in a way that your veterinarian's going to pay attention to, and your rehab team can pay attention to, and everyone can celebrate together when there's progress, and be able to find the right actions when the bad days start increasing. So I really love that. Have you had some feedback yet from the dog owners that are trying it?
Most of the feedback I've gotten is just that more people need to know about it. So I've been trying to work on, advertising and growth, while also focusing on my practice, which has been a little bit tricky. Right now I'm able to public speak and talk to you, and like I can, interview and talk about pet quality of life. But when it comes to actually making like any kind of like influencer video impact, it's just not my thing. So right now I'm just working on getting it to talking to more local vets about it, and just trying to basically offer it to any client that I'm working with here. And then most of the feedback I got is they wish it was in the App Store, that it would be a little bit easier than to log in. And right now it's operating with a token system within the tiered subscriptions, which the developer thought that would be the best way to kind of distinguish the levels of, like, if you kind of have the basic free level, you're just monitoring pain and feeding. But then if you get the elite level, you're able to monitor X amount of seizures and upload X amount of videos. So I think eventually we'll have to probably switch from the token system and then just switch to purely tiered membership, because then they also have access to some different digital products that I've made. You can see here in the I'm not sharing my screen anymore, but yeah, in the resources, a lot of them are actually Onlinepethealth, the private label thing. So there's a lot of those about healing from iliopsoas injuries, or managing patellar luxation, or managing pain in senior pets. And then I have some other stuff that I made on nutrition and geriatric onset laryngeal paralysis, polyneuropathy, and a few other things, just to give owners another tool. I feel like it came out kind of right around when everyone started really just using ChatGPT for all of their things. And I wanted to say, oh, no, you can also just look here, and I've already checked to make sure it's all appropriate. And like you said, just something that you described it as empowering, and that's exactly what I was like trying to allow people, is to take control and to feel like they have the situation under control, that they're involved in their pet's day to day, and that they're a part of this, and it's not something completely out of their control that they're stuck just watching.
Yeah, I like that. Okay, so talk a little bit more about how Rosie Paws is going to help from like the professionals. How are vet rehab therapists, us, going to encourage our owners to use it? Because they're paying for it, we're paying for it. How does that work between the professionals and then the owners?
I'm sorry, could you say that again? Sorry.
Yeah, no problem. If I'm a professional and I'm working with a bunch of clients, a bunch of patients, and I have a few that I want to start using Rosie Paws, I want to recommend that they use this app so we can monitor pain, or we can monitor their quality of life. How am I going to do that? Am I a Rosie Paws subscriber and I'm going to add clients under me, or am I going to recommend that my clients get the app, they're going to pay for it, and then they're going to send the data to me? How does that work?
They're going to send the data to you. I didn't want to, I felt like veterinarians and physiotherapists already have so much to do. I didn't want this to be another program that you were in charge of monitoring. Yeah. So the owners have the ability to export the data to you through either an Excel sheet or just with kind of PDFs of the actual monitoring pages. So they're able to share that with you, hopefully ahead of their appointment, so you have 5 minutes to take a look through everything before you go in and talk to them. And just a way to give the vets and caregivers more information without overwhelming them with record keeping, maintenance, and all the other hats everybody is wearing at their practices.
Okay, amazing. Jaclyn, thank you so much for your time today. It's been really great chatting to you. Guys, I do want to encourage you to go and have a look at Rosie Paws. I think any way that we can find to help our owners to empower them when they're dealing with chronic pain or palliative care is fantastic. And we are a community. Let's support one another. Let's find ways to make this app really, really great together with Jaclyn. If you guys have any questions, please pop them in the comments. I'm going to share a little bit more information about the PLR products that Jaclyn mentioned in the comments as well. So if you want to learn more about that, you don't know about those, you can check the comments when we're done here. And yes, guys, if you are starting an online business, you're doing something different, let us know. We want to be there to cheer you on and to encourage you. Jaclyn, thank you so much for your time today.
Thank you so much for your time and for allowing me to have this platform. And thank you, and Megan, for all that you do for all of us vet rehabbers out there. We really appreciate you.
Thank you. Thank you. Bye, guys.
Bye. Take care.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, the Veterinary Academy of Higher Learning, also known as VAL. Their sponsorship allows us to be able to give you this podcast for free. So please go and check them out at val.vet. Don't forget to bookmark the next Vet Rehab Summit on Saturday, the 14th of November, 2026. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Onlinepethealth members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.